Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. We are going to be talking about adult trauma and how that can impact our kids and why taking care of our own trauma as parents can be so important to our parenting journey. And we have a special guest. Her name's Wrigley, and she is an expert in cognomovement. And she's going to be talking to us about how our body keeps score and why it's important for us to heal our trauma as parents. With that, let's get to Katie.
Oh, thank you for having me, Bryce. I'm excited to be here.
Yeah. Okay. So we're going to be talking about trauma and kind of how our body tracks trauma. So let's start with talking about, do you think that trauma, if we have experienced trauma as adults, that can impact our parenting?
Absolutely. Trauma, actually, that you experience at any point in your life can impact your parenting. It's a matter of what you've done to help release the trauma from the body. But if it has not been released, it's going to impact every area of your life, including and especially parenting.
Yeah. So when you talk about getting it released, what does that mean?
So there's a lot of different ways that we can actually release. Like, a lot of people like to move. There's certain yoga poses that can help move trauma out of the body. But really at the core of it, there's a lot of emotions that tend to go with trauma. There's grief, there's shame, there's guilt, just to name a few, anger. And when we can actually start to focus on the physical sensation that goes with those emotions, which we may or may not be aware of, depending on how much practice, how much therapy we've had. But as we start to pay attention to those emotions that came with the trauma, we can actually release them by fully experiencing them in the body. If that makes sense.
Yeah, totally. So the like just like forget it and move on strategy, not super effective.
No, what happens is you push it down, and there's a lot of this is like one of the top skills of first responders, and I commend them for this skill because that's how they can survive day to day, is pushing it down. You're gonna want to get it out of that little box that you're putting things into, because that box is going to get full and it's going to pop open at some moment that's most likely going to be the most inopportune moment for those little traumas to start coming back out again, like, at a big event for your kid, or maybe something big for your spouse. Like, we don't tend to time those as humans with when we have the space to actually feel them. So you want to be able to go into that box again willingly on your own to look at it. And everybody has a different level of awareness. So one of the dangers, so to say, of putting it in that box is that we don't realize it's still there. But what's happening is the nervous system is spending so much energy keeping that box closed that you're exhausting yourself, and you aren't going to have that energy available for other things. And so the modality I practice, which we'll get into, I think, in a little bit here, but it has that movement piece in there, and it's also focusing on the feeling. So it allows us to be able to break it apart and release it from the physical body.
Yeah. So as you were saying that, I'm thinking like parenting is a stressor, just like in and
Oh,
of
yeah.
itself, even when it's going like quote unquote as planned. I'm not sure what that's like. My life doesn't go like that. But like even if it was going ideally, right? Then but there's just like all the things where it's like you're trying to leave on time and your kid has to go to the bathroom and they're one of those kids that takes forever to go to the bathroom, but like the alternative isn't great. So like you stop and do that, but then you're like, oh my gosh, we're going to be late, right? Like all these things, all these emotions are coming up, and then we're trying to keep suppressing the old feelings. And then we have these new feelings that we're trying to like control. So I can see how even just like something small or a stressor of like your spouse is getting an award or they're graduating from something or a promotion or whatever it is, and that is stressful. Like maybe you don't like a lot of attention on you or whatever, and I can see how the box can get too full and then
Yeah.
all of those feelings come like a volcano out.
Yes, exactly. And I love that you brought up those examples, Bryce, because if you notice that you're low on patience, there may be some stuff in that box to start to pull out at your own time
Mm.
when you're ready. I want to be clear that you want to be ready to do this, because it may be a simple concept, but it's not easy work to do, to deal with our emotions that have come from life events. It can be very difficult, and it's one of the most courageous things you can do. But you are going to get more irritable. You're going to have less patience if you aren't dealing with this stuff. And it's kind of similar to what we see in head injuries as well. Like the physical trauma and emotional trauma can have very similar symptoms, even if we get them in brain scans, it looks different. The outside symptoms can be very similar, like I've already said, you've got a short fuse. You're much more emotional, much more irritable. You may find that you cry more easily. These are all things that can come out of an emotional or a physical trauma. It feels like the world is against you suddenly, like you just woke up one day and everybody's your enemy. And it's not what's actually happened, but because of the physical changes in your brain from the trauma, you are not processing through the normal lens that you would normally process information. So it feels like the world is against you, which is now going to get your back up more. And you'll keep spiraling up and lock yourself into basic isolation, is where we start to see people get when they have all this trauma they haven't dealt with yet.
Yeah. And I think that hypervigilant state where you're looking for the threat, right, where there may not be a threat, right, to be able to have that alert on, right? And you said earlier, talking about first responders, I think, they live in a state of hypervigilance of like everything is a threat because of what they do. But as parents too, we can see that, right? Like we want our kids to be safe and protected, and sometimes we feel like we don't know who we can trust, and I get that, right? There are pieces that we have to go through in order to feel comfortable with our kids going for a play date or whatever. But it's that even when you do know somebody, that you still are feeling really anxious about it, but there's no necessary, like, it's really you, it's not that other person, right? I think that part. And then talking about the patience, like, I know that really speaks to me as a parent. Like, I would say I'm really patient, but there are times where there's just like too many things, right, going on, and my patience gets very, very short. And I hate that part of my reaction to things, because I don't want to be that way with my kids. And I'm sure everybody else doesn't either, because we love them. Like, we would literally give our lives for them, right? Like, I would step in front of a bullet for my kids. So like getting grumpy at them does not make me feel good. But it's like those moments I'm like, okay, what's going on? But that's so good to point out to parents of like a very low tolerance for tiny things or little stuff, and having very little patience might be a sign that you're masking something.
Yeah, or it may be that you just need a break. You may just need to start to give yourself a break. A lot of the parents I know are not the greatest at self-care because you want to take care of those kids so much. And so you put yourself on a back burner, and it's understandable how you got there, but you've got to put yourself on a front burner next to your kids and prioritize your own needs right alongside theirs, or you're going to find yourself drained over and over again. So it may be that it's speaking to, and if you know you've had trauma in the past, and those ideas, those thoughts, those images around the trauma are coming up as you're in these situations with your kids, that's a sign that your body's going, hey, we got something to deal with here. And it's time. Even if you don't want to, it's probably your body gearing you up to say, okay, you're ready to start facing this stuff and get it out of your nervous system so that you can be a better parent, you can have more peace in your body, and you can have an overall more fulfilling life. And we can't have that with the nervous system constantly stretched. Bryce, as you were talking, I was thinking and it's easy to understand how parents get into hypervigilance as well. And I was thinking of the helicopter mom we hear about. That is a great example of a mom whose nervous system tells her that nothing is safe for her kids at any time. And what a nightmare is it for her to be living in that level of fear, because she's constantly afraid that something's going to happen to her kids and everything's getting read as a threat. So it's so important that parents are training their own nervous systems so that you can accurately identify, hey, this is a threat for my kid. My kid is going nowhere near that person. And okay, this is just me being a little uneasy, or maybe I don't like that adult, but they're actually really awesome with my kid. My kid loves them and it's safe for them to be around them. But you can't make that distinction from a nervous system that is spun up. You want to have one that is in a state of rest and digest to accurately be able to assess threats, or more accurately be able to assess the threats that are out there.
Yeah. Yeah. This parenting job is hard. I think
Yeah.
there's just so many layers to it. But excuse me, as you were talking, it made me think of this idea of like, okay, so if we have trauma and we do not work through it, can we pass that on to our kids?
Mm-hmm. Absolutely. So they've actually been able to find, and I've heard a couple of different sources on this, but the epigenetics people that can go way back in the genetic lineage, they're actually finding, and again, I've heard from anywhere from 6 generations to 18 generations back. We are holding trauma in our genes, and we are moving that and passing it forward from generation to generation until we start to heal it. And through my own journey, I've actually healed some of the trauma that my grandfather went. He was in Korea and he was in World War II. And in World War II, he stormed Okinawa. It was a really scary situation for him where most of the troops that he was with all perished, but he was actually one of the few survivors. And that trauma was in his genes when my mom was created, and then still in her genes when she created me with my dad. And so that's continued to pass. How it impacted me, it's really hard to say, but it was definitely in there for sure. And there's a lot of science that backs that. So it's so important. That's a great question, to have parents handle their own traumas as they go, and I also want to mention the darker side of that. If a parent has been sexually abused themselves and they have not come to terms with that yet, they may get into a freeze response if their child gets into the same situation. And now you've coupled it that now you have the guilt of watching your child get hurt on top of your own feelings from what was done to you. So now you've exacerbated a situation. And I want to say again, this is no one's fault. These are physiological responses that come out of trauma. There are so many tools out there to help you get back into a regular, normal physiological response and unwind the impact of trauma from the body.
Well, I think oftentimes when people think about the traumas, I mean, they just want it to go away, right?
Mm-hmm.
They just want it to be not real, right? And there's a grief process that comes along with any type of trauma.
Mm-hmm.
Even and when we define trauma, it's just basically something that your body wasn't able to handle, didn't have the skills, the way to navigate that. And so that could be something really small,
Mm-hmm.
right, in somebody else's mind. And for you was a really big experience. And so I think sometimes people will justify like or diminish their experience to say like, well, so and so had something way worse happen. Like that was so much worse. Like how can I be affected by this? This is not a big deal. But really, your body is telling you it's a big deal. And if your body is telling you it's a big deal, you need to give space to that. And I know it's hard. It's hard for me too, right? Like as a therapist, sometimes I'm like, oh my gosh, yeah, actually, that was really hard. And then I do the work to like process through that. But I think we have to recognize that we have something there that needs to be looked at. And oftentimes we just want to push it away so that we don't have to deal with it. Right. And it's like if it just goes away and then we don't have to deal with it. But what I hear you saying is that's not how our body kind of quote unquote keeps score. It still lives in the body. So how can that like keeping score of trauma live in our body? So like let's say we don't have a conscious memory of that experience, whatever it was, or we pushed it away so intensely that it's not popping up with the pictures of that event. How can we maybe feel that in our body? What can that look like?
So that's a great question. So I'm also a really good person to ask that because my own trauma story, or I should say the story that includes the trauma that occurred to me, I pushed it down for 40 years. So I know what happened. So it came out in started night terrors and I mean, like when I say night terrors, bursting out of the bed, screaming, still in the dream state, running through my house at multiple ages, including in college with roommates, which is not at all embarrassing, by the way. Um,
Yeah,
High
totally.
levels of anxiety. I started getting panic attacks when I was 11. And by the time I was in my mid 20s, I had learned how to talk myself down off the ledge because medications just were not helping for me. Insomnia, aggravation, you push people away from you. You have, depending on what the trauma is, one of the ways that mine manifests was in very unhealthy romantic relationships because that had been part of the pattern I had learned in that trauma.
Mhm.
So it wasn't until I was in my early 40s and my body was fully disabled that I started to actually peel back the layers and see what was there. Chronic pain is another symptom that we see coming out of that. And that was absolutely mine. Allergies getting worsened and worsened. A lot of times we don't correlate that. We just say, oh, the seasons are getting more severe. Allergies are worse. Maybe. But in my experience, if you start to have a more and more severe allergic reaction, it's a trauma that's sitting in the body begging you to look at it. That's one of the ways that your body is telling you that it is in distress. Antihistamines are our first line of defense. And we can actually see this, like you'll see some people out there that have a little bit of a gray tone underneath their eyes. That's actually an allergic response. It's not that they're tired or that they're unhealthy. It's that the histamines are so high in the body that it casts a little bit of a gray tone underneath the eyes like that. And that histamine response, again, that's our first wall of defense, physiological response to trauma there. So there's a lot of different ways that it can manifest. And I almost start to think of anxiety or depression as symptoms of trauma, Bryce, versus being their own diagnosis. Because in my case, that really pointed to so much more that was beneath the surface that I hadn't been ready to look at yet.
Yeah, that can be really hard. So I like that you brought up the chronic pain, because I think, when we get older, right, as we're aging, we we'll be like, oh, this is just, what it is. But sometimes I think it's that we've been through a lot of things that we haven't navigated through. Obviously, our bodies may hurt as we age. I mean, I think that just is how it goes, unfortunately. But something that can keep us from taking care of ourselves too is having trauma where we just don't feel motivated to get up and do something, where we can't stick with something that we choose. Like, we know that, this is a healthy choice for us and we really want to do that thing, but we just can't stick to it. Right. And I know that habits are hard to develop. I mean, both undo and start. But I think it's good to look at this. And I think the thing that people don't recognize is how much trauma, how many experiences we have in our lifetime that are hard on our body and our brain, and that we do need to be able to process through. I think there's a statistic that says about 70 to 75% of 17-year-olds, or by the time they graduate high school, have experienced at least one significant trauma. So that's a lot of, we have so much life after that, right? That's just the beginning. So it's if that's one, but then, and I think obviously there's lots of factors that go into this, where you've grown up and what your family looked like and all of those things. I think these are a lot of times outside of the home traumas that are happening, but within our home, there's definitely traumas that can happen. So I think there's a lot of space for traumas to happen, unfortunately. And if we process through them, can we be healthy? If we're working through the traumas as they go.
Absolutely. You can actually prevent yourself from having it turn into post-traumatic stress disorder too, or I like to say PTSI or just PTS. So, and you had said something a while ago, I wanted to circle back on, Bryce, as well, is trauma is not the place to do a comparison. Actually, anytime you're comparing yourself to anyone else, you're setting yourself up to potentially increase the pain level in your life. But in trauma, this is one of the worst places to do a comparison, because there's always going to be something worse that happened to someone else, but it doesn't mean that what you went through wasn't traumatic all on its own. Shh. My cat is very loud, pardon me. It doesn't mean that what you went through isn't traumatic on its own. And depending on when it happened and how old you were, they have studies, Dr. Peter Levine talks about this in Waking the Tiger, that infants that are left alone in a cold room that are too small to cover themselves, that's read as by the nervous system as a trauma, something as little as that. So it really, we can't compare to other people. And it's so important that we acknowledge without judgment that what we happened, our body is giving us signals that it's not okay in those moments. And we do have things we can do, but you can absolutely heal from trauma. And the other thing that you said, Bryce, that I wanted to comment on was, we just want this to go away. You didn't get a choice in what happened to you. And chances are it was not your fault. You did not do anything that led into that situation. But where you do have a choice, where you do have power, where you have agency, is what you do with that traumatic event. That is where all of your power is. That is where you can choose to move into post-traumatic growth and become your own hero, or you can stay stuck in post-traumatic stress and stay trapped in victim mode and go through all of the pieces that come from, and there's a lot of people that have a hard time getting out of victim mode because it can feel safer to be in there. And it takes courage to move it into post-traumatic growth and allow yourself to get these traumas out of the body, to allow yourself. And there's a big component of shame that comes with it as well. And that pattern of shame running is it's going to be one of the things that keeps you from those healthy habits you were talking about, Bryce, is if we don't think we're good enough to take care of ourselves, we're going to continually find reasons not to. And that's a huge outcome of trauma, is that a lot of people who've been through trauma come away thinking they're not good enough because they must have done something to deserve that mistreatment, even though it's not true.
Yeah, absolutely. So, I mean, I think as parents are listening to this, they're like, okay, yeah, I've had some stuff that's happened, but I'm so busy. Like, I am a parent. I have all these layers of things to do. Do you think that there's space for parents to be able to work through their trauma while they're parenting?
Absolutely. So, and everybody's schedule is going to be different. And I'm not knocking anybody for this, but if at any point in your day it involves a Facebook or a TikTok or an Instagram scroll, you've got some free time. Just saying. Like, it may be fun to do all that, but that's going to be stimulating your nervous system versus taking time and allowing it to get out of the nervous system. So there's a lot of different things you can do. You could start to just meditate 5 minutes a day. You can increase that from there. That's going to strengthen the prefrontal cortex. That's the part of our brain that's responsible for executive function, for rational thinking, for being reasonable. All of that comes from the prefrontal cortex. Strengthening that is going to really help, and it's going to keep you from being in that reactive mode, which comes out of the limbic system, which is at the very base of the brain. So your limbic system is what reacts with anger, with pain, with whatever it may be. If you're able to just hold it in for 90 seconds, breathe into it, allow yourself to reverse, just allow yourself to feel that feeling without talking, it is going to dissipate and you'll be able to respond more, but you can't do that without a stronger prefrontal cortex. And then of course, my favorite is cognomovement as a quick way. And we see people doing just daily 15-20 minute sessions on their own, and they're able to help move themselves forward without it being a huge time ask for them.
Amazing. Because I think, I mean, I know that myself, right, as a parent, but just as somebody who works and all the things that I'm doing, it is hard to find time. But I also know that, like, when I do something like walking our puppy, and that part makes me feel better, even though it's like, maybe I actually don't want to get up and do it. It's cold or whatever, right?
Yeah.
I do feel better when I do it. And so I think, even though it may feel inconvenient and new and scary, it does benefit us. And so
Yeah.
I do agree parents can heal in the midst of their parenting journey, because I think realistically, parenting never ends. Even though our kids get bigger and they may not need us in the same ways, your parenting journey is not going to end. So I think waiting for that to get a break is not necessarily going to be the best path, because I don't think it just ends, right? Like, we're going to still have those things going on.
Oh yeah. Yeah.
So what do you think are the signs that my trauma might be impacting my kids, right? So if I'm a parent and I have trauma, like, how can I know if it's impacting my children?
That's a great question. So there's a few things you may notice. Again, it may be in the way that you're approaching your kids. If you're approaching them with fear, if you're feeling your stomach tighten, and that's the advice you're giving them out of that, that may be coming out of that trauma versus out of a love response or an expansive response. You may also notice a pattern you used to do in your child. And if you know that that pattern came out of your trauma, that can be another way of saying, okay, my child is now learning from me. They're taking this pattern. I know this came out of a trauma. And that one may be harder to identify. You're not going to be able to look at a pattern and go, oh, I do this because I was traumatized. Like, you're going to need like someone like you, Bryce, to help someone see, okay, yes, this is what's happening. This is what you do when. I'm trying to think of an example. I'm totally blanking on an example right now. But there's going to be indicators. If you're noticing that your kids are acting out and it's not the normal way that a child would act out, because they're going to push you. That's part of them being kids. And for those who are parents of teenagers, just as a heads up, the most active part of a teenager's brain is the part that argues. So your teenager is literally hardwired to argue with you. That's going to be difficult for any parent to be able to navigate, because you've got a child that is automatically going to oppose everything you say. And so being able to discern the patterns that are not part of normal childhood, that's going to be a little bit trickier. But when you are able to do that, or if you start to notice there is a different pattern, that could be something that's coming from either one of your traumas, or it could be something that's happened to your child, and your child's behavior is subtly alerting you to what is going on.
Yeah. Yeah. I think, as you were talking, two things that stick out for me is I'm always looking at my kids' behaviors, like what they're doing, and seeing if there's something that I'm also doing that sounds like whatever that is that's happening. And sometimes it will be like, scolding the dog, right? Like the dog pooped in the house the other day and I was like, oh, bad girl. Right. And then my 2-year-old's like, you're a bad girl to the dog. And I was like, oh, that just didn't sound right. Like we can do this different. Like she really isn't a bad girl. She's a good girl. But like in that moment of frustration, right, it came out. So like, I think it's also like seeing how our kids are saying things, mimicking what we're doing of how they're handling their emotions. Right.
Yeah.
So if they're talking like in that moment, I wish I would have been like, this is really frustrating, right? I just had the dog out and then she pooped in the house, right? Like, but she's a puppy and she's learning, and right, like talking through that would have been so much more effective. I would have gotten my feelings out. The 2-year-old would have heard that, right? He wouldn't have said bad girl. Like just thinking about like, how are we processing our emotions too, and allowing our kids to see that we're processing through. I think that can be an important part. But then
Yes.
also like thinking about like their trauma, like connecting with our kids. I think knowing our kids, because every day each of us is new in some way. We have new cells, new thoughts, new ideas. And so our kids are exactly the same. So like even if you may have talked to them about a friendship last week, I mean that friendship may be in a different space this week. So being connected to our kids, curious about what they're going through, I think those are the things that help our kids to say when they've had experiences, right? They're more likely to say like, this thing happened, or when you notice their behavior changes, that you might be able to be like, hey, you seem like something's different today. Like I'm just noticing a different energy about you. Are you okay? Has
Yeah.
anything happened? Is there anything we can talk about?
Yes. And don't be afraid to talk to your kids. Like, and spending time on the phone, and that's another piece we didn't have to deal with as kids, is we didn't have these electronic devices. And part of what they're doing with all the conveniences they give us, they're also taking away some of our ability to communicate and interact as human beings, because we're losing some of those skills in there, like being able to see the other perspective, which adds another level of challenge to kids of today. As you're watching though, and and I've heard some parents are like, well, I'm afraid to say that to my kid, they're going to get mad. Like, kids should get mad at you. Like, you should be pissing off your kids every once in a while. It means you're being a good parent. Like, you don't want your kids to be happy with you all the time. They aren't getting the discipline that they need if they are constantly happy with you. So don't be afraid to stand up to them. You are the leader. You are the head of the household. And there's different ways. Like, we don't want to be doing that with force. Like, I love how you like led through, oh, that would have been great if I'd said, oh, this is really frustrating. But again, like you're reacting, you're angry because you just took the dog out. And so your reaction is understandable too. And you could go back to your kid, or you may have already, and said, hey, a better way for me to have handled that would have just been for me to let the anger pass through, notice that it's there, and then say, okay, that was really frustrating. I want to do this differently next time so that the dog isn't feeling bad. And, she's a puppy, she's learning, and however you want to communicate that. So it is something you could go back to and readdress, but it's going to be practice to have that in where you aren't reacting. And I don't expect anyone to be able to do that out of the gate. Like that is a learned skill that takes a lot of self-control, a lot of discipline, and a lot of emotional maturity, not to spit out those biting words we want to spit out, because it helps offload a lot of it when we're in those emotions in the moment. Like we get them out like, oh, I feel so much better. But then we regret it later. Like, that's not really what I meant. Like I meant this, but we don't have that in that initial burst, that 90-second burst of emotion. It's just not there yet. But modeling how we want to show our kids, and even when we don't do it perfectly, going back to them later and, hey, this is a better way to do this because this is more likely the outcome here. And now we're acknowledging the dog, what her limits are. We're acknowledging our own feelings about why we're actually angry here. And we're able to find a more peaceful outcome for this, which is going to feel better for all of us, and have whatever word you're using with whatever age your kids are. Like, obviously saying that to a 3-year-old's going to be like, huh?
Yeah.
It's going to go right over their
Yes.
head.
Yes.
But a 10, 12-year-old, they're going to understand that.
Totally. Yeah. Well, and I think that's such a good point of like the emotional maturity that we want our kids to have, right? Is taught, is learned.
Mhm.
It is not something that they are born with. We do not have the ability, like thinking about infants, like they do not have the ability to regulate. They need us to be their regulation. And I don't know that I can say that teenagers don't need us to help them regulate. I don't know that I can say that I don't need my husband to help me regulate. Like, I mean, obviously I can do it by myself, and I do lots of the time, but there are times where I'm like, I just need you to hug me. I just need you to hug me and tell me it's okay and we're going to get through this. And that's what I need, right? So I think sometimes we expect a lot of our kids to just be able to handle it, be able to do it, right? And I think that's a potential missed opportunity of connection and attunement and just love, right? To be like, it's okay that you don't have this all figured out. I don't have
Yeah.
it all figured out, right? Like I tell my kids, I'm just one mommy all the time. I mean, they're probably tired of hearing it. Sometimes I hear them say like 2 or 3 of them, or sometimes all of them will ask me for something like right at the same time. And they'll be like, she's just one mommy. She can only do one thing at a time. I'm like, thank goodness this is getting through. But I mean, how many times have I said that? So like us modeling this emotional regulation, I mean, this speaks to why dealing with our own trauma is so important. Because if
Yes.
we need to show up for our kids to teach them how to regulate to emotions, how to handle hard things, how to talk about our feelings, how to respect ourselves enough to deal with the things that we've been through, to care about ourselves as much as we care about other people, then we've got to do the work. We've got to show up for ourselves, which I think to an earlier point was it's hard to take care of ourselves sometimes because we're so invested in taking care of our kids.
It
So
is.
what do we do if our kids are triggering our trauma?
So if your kids are triggering your trauma, that's a great chance for you to pause and be like, okay, what is triggering me about this? Is it their response? Is it the amount of emotion behind the response? Starting to identify what is there. But if you are finding yourself triggered, it could be that they're at the age that you were. So finding the identifying characteristics that are triggering your trauma in that moment is really important. And then getting help from someone, from you, from me, from someone who is trauma informed, who knows how to help you get that out of the system. Reach out to a professional to help you start to unravel that. It doesn't have to break the bank. It doesn't have to be a long commitment. You can start to use these tools and learn these tools and start to incorporate them into your life right away. And that's going to help your kids get more adjusted, and that's going to help. And then you're also modeling possibility. And so as you're watching, your kids are watching you do this work and help yourself feel better, they're going to be more likely to take that own action for themselves if they ever find themselves in a similar situation, or even if they just notice that they're getting distressed a lot, they're more likely to ask for help because they've seen you do it. So your ability to model is huge, and your kids are going to take after that. Like, you hear a lot, like, as adults, oh, I turn into my mother or my father. It's true, because that's what we saw so much of as kids. That is going to be a big piece of what dictates our behavior and how we interact with other people, especially when we have our own kids. And we can choose to continue to go into those patterns we learned that we really loved as kids. And it's also an opportunity to change them too. But that modeling there, that is going to be what the kids are going to follow first until they're adults and they're aware enough to make the decision of whether they want to continue that cycle, that pattern, or not.
Yeah.
Hopefully that answers your question.
Yeah, absolutely. So I think, one of the things that's hard when you've had trauma is that when your kid's talking about this triggering part of like, they do something and maybe we overreact or we shut down, right? Like, so we have huge reaction to something that maybe is pretty small, right?
Mhm.
And we're maybe screaming or whatever it is. We're having those biting words that we're saying to these people that we love. How can we stop ourselves from doing that as parents? Do you have any advice on that?
So that's going to be that pause, which is going to be a learned practice. That's going to be a more challenging habit. So if you have done that, own it to your kids. Go back. I am so sorry I spoke to you that way. That was not me at my best. Whatever, again, whatever language you use with your kids, but own it and model again. Hey, this is what we do when we make a mistake. Because we don't learn how to deal with tough emotions as kids. We learn all this stuff in school. We learn about our history. We learn different things about our culture, but we are never taught how to deal with emotions. We watch how our parents do it. That's really the only way we've learned. But unless we've got a parent that's really aware, which I've literally never seen, doesn't mean it doesn't exist, but I've never seen a parent be like, oh, I'm experiencing grief right now, and this is what it's going to be like. I'm going to have ups and downs. It's going to come. No one talks like that. And so it's when you have these emotions coming up, this is an opportunity to teach your kids and start to teach them, hey, this is how you can start to deal with this stuff. Like when you lose a pet or a person at a young age, hey, grief is tough. It comes and goes in waves. And what's interesting about grief, and again, depending on the age, like it's not the only thing that's happening at once. Like you can be grieving and you can have a good day. You can be grieving and you can also have anxiety. You can grieve and you can experience joy. And all of this can be going on in the body at once. Teaching them how to deal with stress. Like as they're freaking out about school, okay, like what is so important to you about this? Like what has you so riled up? Okay, well, I need to be perfect. Okay, well, I'm going to let you know right now, kid, there is no perfect human being. So you get to let go of that. Like it may be hard for you to let go of, but every human makes mistakes. So what's the best outcome you want to have here? And just help start to pull them away from that perfectionist bug or whatever it may be. But taking that opportunity, meeting them where they are, and then helping them, owning what you did, helping move through it. And the next time they trigger you again, walk away. So one of my clients, she had a really hard time. If one of her kids triggered her, she had a hard time being in the motion. And so what we did is we created a new pattern for her. So she would walk away from the kid. She'd take a breath. She would walk away from her kid. She would go make herself some tea. She would come back in. So that 90 seconds window had time to pass. She'd do breathing as she did that. And she'd go about, okay, this is what bothered me about what happened. And she would be able to clearly communicate just that 2 to 3 minute process. The kid doesn't feel abandoned. She's only gone for a couple of minutes. And she built that into her response so that she didn't react and yell at the kids because she was feeling so bad, like, oh, I yelled at my kids again. And okay, so we looked at that. Okay, what is the pattern with yelling at the kids? And so we really looked at that. And then at that point where she could not stop herself from going forward, we created a new pattern that she could go into, circle back to the kid with a rational mind and work through that with them. And the response from the children was huge, so positive. And they came to her with more and more. And they were sharing more and more of their lives just because she stopped reacting to them. And she got to a place where she was able to respond.
I love that. That's so amazing. Because I think we don't think about that in the moment. And something you said earlier too is like talking to our kids about their emotions, like if they're trying to be perfect on something. I think for me, like in those moments is great. But if we can do it ahead of time, where we're just talking about like we make a mistake and we're like, yep, like I made a mistake.
Yep.
I'm still learning, right? Like, and we're all learning. No one's perfect. Like, I think that sets the narrative of like, we can make mistakes. And, like I joke that probably when my kids go to college, like they're going to finally realize that not everybody talks to themselves like I do in particular, but it's always like, I'm like narrating like my whole life sometimes because I'll be like, oh shoot, dang it. I did this. Right. And then I'm like, okay, how are we going to fix this? And so like, even though I don't need to, like I can do it all in my head, but I'm like, if I'm having this thought, I might as well share it with them to be like, I was making cookies a couple weeks ago and I accidentally put in too much sugar. I was like distracted and I put too much in and I was like, okay, how are we going to fix this? And I was like, I guess we're making more cookies. Like this is the best way to, like we could just amplify up to what I did put in. And so
Yep.
we problem solve through that, right? Of like, it's okay. And sometimes if you have to throw it out, then you just do, right? Like sometimes that's just how it is, right? Like we can try to find a solution, but if I throw away butter and sugar, like it's not going to end the world. And if that means we can't make any more cookies today, then okay, that's a bummer, right? Like, but we can get through it. So I think, yeah, it's about practicing it and talking ourselves through it. And sometimes when we verbalize it out loud to our kids, it helps us to calm down too, right? By putting those words to it and being able to not have it all in our head. Because sometimes when we think negative things, then it just like becomes more and more negative. So if we're like externalizing it, helps too. There's so many parts of being a parent that are so challenging. What do you want parents to take away from this conversation?
That you're already doing a great job. Most likely, even without knowing you, I know you're doing a good job and you've got your hands full because you are a parent. Give yourself grace. The same grace that you give to other parents when you see them struggling, give that to yourself as well. And try to do it differently next time. Like learn from what feels like mistakes, from errors. Like maybe you taught your kids in that moment, instead of Bryce going, up, we're just going to make more cookies. Maybe you taught them that cookies are something that warrant a complete emotional meltdown. You can still teach them a different pattern from that later. So don't beat yourself up if you're like, oh man, I've done all these things. You're human. You're a parent. You didn't have any other awareness to make different decisions. Now you do. So now you can start to go forward and make different decisions that allow you to be more connected to your kids, and you're teaching them and modeling them the behavior that you want them to take as they get into their teen and adult years.
That's amazing. Thank you so much for your time today. This has been awesome.
Thank you, Bryce. It's been great to be here.
Thanks again, Katie. That was such a great conversation. I so appreciated this idea when we know better, we can do better. And that as parents, we don't have to suffer with our childhood experiences or our experiences in adulthood, that we can heal ourselves. And that part of taking care of ourselves actually helps us to heal our children and helps them to have the best life possible. So us taking care of ourselves is part of our, I'll say, obligation as parents, is to heal the things that we're bringing to the table so that we can raise healthy humans. With that, I will say thank you so much for listening today. Please rate and subscribe to our show. Please like us on Facebook and Instagram and YouTube and TikTok. And also keep the emails coming with topic suggestions for future shows to accidentalexperts@gmail.com. Have a fantastic day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.